Last time I went over major depression, its symptoms, and other types of depression. Today we'll get into the causes of depression as well as professional treatment solutions. What might be a good indicator that you're at risk for developing depression? Look at your dad and mom. Do either of them show signs of depression? Aunts or uncles? What about grandma and grandpa? It's not a problem if just one or two people show signs, but when it's a recurrent pattern throughout the family tree, then I'd be worried. There's evidence that depression has genetic factors, and this is true for most mental illnesses. But also, having a family who's predominantly depressed doesn't necessarily mean that you'll develop it either. Our genetics create a predisposition for us to develop things. This just means that we can have the gene, but it doesn't mean that it'll overtly affect us. A lot of factors go into play. If you're interested in learning more about what dictates genetic influence, I suggest looking into epigenetics. Our environment is also a good indicator. If you have a lot of major life changes, trauma, or physical illness, you're more likely to develop depression. Our family life, social life, or lack thereof can predispose us to depression. Low income and social status are also correlated with higher levels of depression. Oddly enough, our thinking can put us at greater risk for depression. Most people aren't fully aware of what they're thinking about when they're sad, but you'll find that it's usually negative. So next time you're feeling sad, I challenge you to pause and look at what you're thinking about. Most of the time it'll be something negative, like, I'll never escape this situation, or you will be ruminating on something that happened. Sometimes it can be our own brain that's at fault. This is slightly tied in with genetics because our brain's chemistry is dependent on how the brain's programmed. For instance, the brain produces certain neurotransmitters, which are chemicals that allow neurons to communicate with each other. And an unbalanced level of these chemicals in the brain, either too high or too low, has been linked to depression. The main neurotransmitters being serotonin, dopamine, and norepinephrine. It's for this reason that medication is commonly used to treat depression, but normal things you do every day can help regulate these chemicals, such as your diet, sleep, and regular exercise. We covered some of the causes and risk factors, but you don't want depression, so how do you get rid of it? There is a huge variety of treatment options, from the classic to the bizarre. First, you have traditional psychotherapy, counseling, or talk therapy. You just sit in a room with a professional and they'll assess your situation and come up with a personalized treatment plan. Now, I don't want to pervade the myth that the therapist does most of the work, because in most modalities, they'll actually have you decide what your goals are and how to complete them. They do offer interventions and information that most people don't know about, however. It can be a really worthwhile experience, even if it's just for self-growth. The best modalities for treating depression, I think, are cognitive behavioral therapy or Rogerian. The cognitive behavioral therapist will look at changing your thoughts and behaviors in order for you to change how you feel. This one, the therapist does a lot of the work. Rogerian therapists, however, mainly focus on validating your feelings and encouraging you to come up with your own solutions for your problem. I may have future videos that discuss the different modalities. Secondly, you have psychopharmacology, which is exactly what it sounds like. A psychiatrist will personalize medication to fit your needs in order to help your brain reach homeostasis or normality. Do you remember how earlier we talked about the neurotransmitters and how they can be either too high or too low? Well, the medicine that they give you will normally help regulate that system. The third treatment option is consulting either a dietitian or your primary care physician/doctor. Your diet, exercise, nutrition, and sleep all have a great effect on your mental health. These professionals can help you assess if you have a deficit in any of these areas, and they can give you direction if you are. I highly recommend this option before getting medication. Lastly, and not to scare you, but there are a variety of brain stimulation treatments. The best way I can describe them is like getting a jump for your brain. Electroconvulsive therapy, or ECT, is a lot safer now than it was in the past. And what you see in movies is not actually what it is anymore. It is painless, you're put under, and you can't feel the electrical impulses. A miniature version of this has been in development for some time, being called a brain pacemaker. You also have this thing called repetitive transcranial magnetic stimulation, which is magnetic instead of electric. It is as effective as ECT and has even produced beneficial results in healthy patients. Today we covered risk factors, causes, and professional treatments for depression. Next time I'll cover things that you can do in your own life to either prevent or combat depression. In the comments section, see if you can answer these questions. What are some of your experiences with these treatments, if any? Do you have any other treatment options that I left out? I hope you guys enjoyed this video. Do me a favor and have a nice day.